So today we're going to be going over our quarterly dosimetry report. So what I'm going to do is talk about the readings that we have here. So like I said, ours does it quarterly. We send it out to a second party, and it will follow you wherever you go. So wherever you change jobs, your readings should follow you to each place. And the maximal permissible dose that you're supposed to that you can't exceed over is 5,000. Looking at a report, no one has gone over that report. I'm going to go over mine. So on my section, it does the deep eye and shallow dosage for your current, the year, and your lifetime dose. So I have not gone over the 5,000. My lifetime dose is for deep is 69, eye is 69, and shallow is 65. And for my current dose and the doses for this year, it's 13, 15, and 14. So you can kind of look on here. So no one will go over the 5,000 REMs. And so that is our reading for our quarterly dosimetry report. So now I'm going to talk about the 3 different types of restraints used for taking x-rays. So the first one is always going to be manual restraint, which just means you and a coworker, or if you can do it by yourself, you're going to be restraining the patient on your own with no type of aids or chemical aids like that. So that includes making sure you're not looking directly into the light and no part of you is in the beam. That includes you wearing a glove. Your glove does not protect you from the direct beam. You will still be exposed to radiation if your hand or any part of your body is in that beam. So when you're holding the animal, just make sure you are completely out of the light and then look away, especially if you don't have your lead-lined glasses that are available. At some clinics, the next thing is going to be our chemical restraint, which is sedation. This is the one that you should use if possible for almost all x-rays. You're able to obtain a really good x-ray on the first try, so it's less exposure to radiation for you and the patient. And then the last one is non-manual restraint, which means you're using positioning aids to restrain your animal, so tape or troughs or any type of rope or leash that you can hold on to, so you are farther away from that light and the radiation that happens from the scatter radiation. So now I'm going to talk about visibly inspecting your PPE, which you should do every time you put it on. You want to make sure there's never any cracks or visible tears in your PPE. You also need to radiograph it to test it each. There's a certain time for each one, so your gown you do once a year, and your gloves and your thyroid collar you're supposed to do every 6 months. That's just to make sure that they're still protecting from the radiation and everything is okay with your PPE. If you ever see any types of tears or cracks in your PPE, you should not wear it, because that means that scatter radiation will go through the gown, so then you're going to be exposed to radiation. We're going to be talking about discussing what physical barriers are out there besides your PPE. So if you don't have protective equipment, what you can do is just completely step out of the room. To be able to do that, you do have to have an x-ray machine that has a pedal or a button on the outside of the room, or you can step behind a lead-lined wall. Those can also protect you. You should always be wearing your PPE, but that can also be worn if needed. The next thing we're going to talk about is how to explain your distance and exposure time, how to decrease that. So you want to always take your x-rays quick as possible with the lowest MAs as possible to decrease your radiation time. Next thing you need to do is try to stay as far away from possible. So like I said, if you can be out of the room, be out of the room. And if you can be as far away, the farther you are, the intensity is decreased by a quarter if the distance is doubled. So those are some ways you can be less exposed to radiation, but you should still always be wearing your PPE. I'm going to talk about why non-essential personnel shouldn't be in the room and why you should always try to get your image you're taking on the first try. So they kind of go hand in hand together. You want to decrease your radiation exposure no matter what. So if you don't need extra people in the room to take the x-rays, they should leave the room. And then for your patient and for you, you always want to try to get it on the first time, because it decreases your exposure to the scatter radiation. And the less people and less exposure you have is better for you in general. We're going to talk about why women that are pregnant or anybody under the age of 18 should not be around any type of radiation or in the radiology room. So with women, especially when you're in your first trimester, the fetus is most sensitive. If you're exposed to any type of radiation, it can cause genetic mutation, cancer, or even loss of the fetus. So pregnant women should always notify their supervisors and stay out and away from any type of radiation, including dental x-rays. For children or anyone under the age of 18, they're at a higher risk of getting damage to their cells. It can make their cell division slow down. They can also have genetic mutations just because they're still developing, so they're at a risk for higher radiation dosages whenever they're exposed to it. So like I said, if you're under the age of 18 or pregnant, you should just stay away from the radiology room, including dental x-rays or any type of x-ray you are doing. So for our cradioconal radius ulna image that you're taking, the anatomical landmarks that you are going to collimate to are going to be proximal to the elbow and distal to the carpus. And then you also want to make sure the beam is centered on the long bone and make sure both joints are in the view. For our VD thorax view, you're going to collimate to the thoracic inlet cranially, and then caudally you're going to collimate to the first lumbar vertebrae, and then you want to make sure the beam is centered on the chest. And then for our VD pelvis, you just need to make sure you measure the thickest part of the pelvis. You also need to make sure you measure the trough because you are going to collimate to the trough. So you want to have the correct measurement to make sure you get the correct amount of radiation for the image you're taking. So today I'm going to talk about the process of a barium study. So first we're going to talk about the negative effects of a barium study. So some effects can be constipation after you give the barium. They can also aspirate when given the barium orally. And then you're also, if you give the powder form, when you're diluting it with the water, you have the risk of over diluting it, so then you're not even giving the correct amount of barium. You also need to make sure they are fasted 12 to 24 hours prior to the study. You need to do an enema the night before and the night of, or in the day of, and you want to do that 2 to 4 hours prior to the study to decrease the amount of gas in the intestinal tract. You also, when you're measuring to take the image, you want to do the thickest part of the abdomen because that's where you're going to be taking your images. You're going to take pre-images to make sure all of your settings and proportions are correct and what you're needing to do, and then every image you take is going to stay on those settings. You will do lateral NVD or ventral dorsal images at the time the barium is given, and that's going to be your 0 time. And then we did ours on a dog, so your intervals are going to be 15, 30, and 60 minutes, and then you take it every hour, an image every hour thereafter until the barium reaches the distal part of the small intestinal tract. And that is how you do a barium study.